You want to start recording? Here we go. Pressure's on. All right, so I'll just give you just a little bit of background, and then you can do your thing, okay?
All right.
Take your time. We can take as long as you need. I don't have anyone after you, so take your time. So I am a 21-year-old track athlete with pain in the back of my heel. Okay?
All right.
Go
Okay.
for it.
Solid. Okay, so you're a track athlete.
Mm-hmm.
Do you know what you did to
Okay.
Yeah, sorry.
Like when it first started?
Yeah, when it first started, do you know what happened?
No, it's kind of been going on for a while. I don't really remember like one incident where it happened. It's just kind of been this annoying, painful pain in the back of my heel for about a month.
About a month?
Mm-hmm.
Okay.
Really, you are sounding disgusting.
Can you walk?
It's painful when I walk, especially when I run.
Okay. Have you still been practicing and stuff? And
I've tried to. It's just very painful.
Okay. Is it like a shooting pain, or does it radiate anywhere?
No, it doesn't. Maybe just a little bit up in my calf, but it more feels like a kind of stiffness in my calf.
Okay.
But no, not really sharp shooting, more just kind of like a maybe burning kind of.
Burning?
Mm-hmm.
And it's on the, like, can you show me where it's at?
Yeah, yes I can. It's like right here on the back of my ankle.
Okay. Are your shoes rubbing onto your foot at all?
It does hurt. Certain shoes do hurt really bad, yeah. Really wants to be a part of this.
So the shoes, do they rub on the back of your heel, or is it just like,
Yeah, I mean, I wouldn't really say rub. It's just kind of like certain shoes, if it like hits it at the right spot, it hurts.
Okay.
Makes sense? It's not like a blister. It like doesn't feel like a blister.
It doesn't, or it does?
It doesn't.
Okay.
It's not like a rubbing shoe. If that makes sense.
What mechanism, or what, sorry.
Yeah, I'm not an athletic trainer. I'm just an athlete.
So you can walk, but it's painful?
Yeah, I can walk. It's just very painful. Especially like when my heel is, when my heel is like that.
Okay.
That position, it really hurts.
And what have you been doing to help the pain for the past?
Mostly just ice and like ibuprofen, and when I'm not walking or running, that's helped. Other than that, nothing really.
Okay. Has any of it helped at all, or no?
Yeah. The ice and the ibuprofen has helped. I mean, it's not. As soon as I start running again, it starts hurting.
Okay. All right. So I'm gonna have you do some things real quick.
Perfect.
So could you stand up for me and?
Yep. I'll turn this way. Okay.
Could you walk on your heels for me?
Yes. Can you see my feet? No. Not quite. Okay. Yeah, that hurts.
That hurts?
Yes.
And now could you try walking on your heels for me?
Oh, is that what you said the first time?
Yeah, but it's okay.
Oh, sorry. Yeah, that hurts.
That hurts too?
Yeah.
And could you try walking on the the sides of your feet?
The sides of my feet? Can you
like,
see me?
try.
like
I
that.
can. Yeah.
That doesn't. I mean, it kind of hurts a little bit.
Okay. And we'll try the midfoot or on the inside of your foot. Could you try
Okay.
walking?
Yeah, that hurts.
That hurts too. Is there anywhere else that the pain is, or is it just in that direct spot?
It's just in that spot.
Okay. Oh, okay.
Anything
So
else?
let me see what else we can do over here. Um, do you have a wall over there that you
Yep.
could use? Okay. So on your injured foot, could you put your foot up like this and then try and push against the wall?
Yeah, that really hurts.
That really hurts.
Yep.
Okay.
And I kind of almost feel like there's like a crackling sound. I can't, and I can't go as far with this one as I can with the good one.
Okay. So it's like a gradual, it came on, or there's a
Yeah.
gradual coming on
Yep.
of pain, and then now you start to hear popping, or
No, it's just like when I like have my foot up like I just did. It
yeah,
kind of like there's kind of like a crackling, you know.
yeah, okay. Have you had a history of this before? Like, have you had any injuries to your ankles
Um,
previously?
Not really. Well, last track season, when the season first started, I kind of had similar experience, but not as bad.
What? Well, I don't know. What did you do for that?
Um, well, I actually broke my arm last season, so I didn't get to run.
Okay. Um. Okay. Um. Let's see. Uh,
You're good. Is there anything that you want to see or
yes.
okay?
But like, this is hard. Like to come up with manual muscle tests for the ankle.
Yeah, I know.
That is like at home kind of things.
So if this was a in-person eval, something that you don't really get with a telehealth eval is you actually get to see it and feel it. So something
Yeah.
that would be helpful is if you try and have me describe to you what it looks like and feels like.
Oh, so
That'll
like
kind of help you get
palpations
start. Yeah,
kind of
help
thing.
you get start.
Oh, okay. So then have you palpate yourself and then tell me.
What's palpating?
Can you touch your where it hurts and around and tell me what it feels like? And then do
Yeah,
this.
it's kind of tender. It's kind of warm too, I'm noticing.
Okay.
The skin around there is a little red.
And can you do that with your other foot as well and tell me if anything feels different?
Um, my bad one feels a little different. The good one doesn't hurt at all when I touch, and the bad one almost feels like spongy, if that makes sense.
Yes, that does make sense.
Okay.
Whoa. Okay. What else? Okay.
You're good. Take your time. Think about what you would do if you were in person.
If I were in person. Okay, so palpation. Let's just do. Could you?
You're good. Go for it, girl. Just do it. What you're thinking, do it.
Um, what I'm thinking. Okay. So could you try and point your foot down for me?
Yep. Yeah, that
Mm,
kind of hurts.
that hurts.
I don't feel like I can go as far as I should be able to.
And then could you? Yep.
That one doesn't go as far as the bad one.
And then could you point your feet up for like try and
Yep.
bring your foot? Huh.
It hurts to go all the way up.
Okay. Let's see. So
What are you thinking? You thinking you're ready to give me an answer?
yes, I think
Okay. What are you
so.
thinking?
Um, was kind of between two,
Okay.
but I think
So tell me some of your differential diagnoses. Diagnoses
so. Um, that I've seen.
that you think. What are your possibles?
Okay, so I'm thinking the retrocalcanea bursitis,
Okay.
and then the I can't say that. Um,
Appendicitis.
apophysitis.
Okay.
Yes. Um, there's the one that's like the Osgood slaughters, but like for the calcaneus, and it's like it's pulling, and there's a little bump on the back. Well, no, yours is squishy. Never mind. Erase that one.
Okay. So those are your two.
Yes.
Um, so how would I treat this?
So we would have you rest, or I would have you rest for a while, and then ice, and then we could do a little donut on the back, like once. Yeah, and then
So
you.
you're thinking it's which one? What's your guess?
Right now, I think it's retrocalcanea bursitis.
Yeah, you're the first person I've had get one right. Good job. Okay. So just some notes here.
Yeah,
The reason I did bursitis. First, let me ask you why were you going more bursitis and not tendonitis?
because you said that it was warm and squishy.
Good. Okay. So the reason I picked bursitis is because a lot of times, and I told this to Ariel too, a lot of times as athletic trainers, when we see chronic injuries, especially like right on the Achilles, we just go straight to tendonitis. You know,
Yeah,
it's the easy answer. It's treated exactly the same as bursitis. So if you're wrong, it's not a big deal. But to be able to differentiate between bursitis and tendonitis is good. And it will just help you improve your evaluation skills to differentiate and not just jump to the first easy conclusion. So good job with that, asking more questions and not just going straight to tendonitis. The treatment is the exact same, so it's not really a huge deal if you did, but good job with that. One thing that you probably could have asked a few more questions about is history.
yeah,
Um, so if you would have asked, I could have told you I haven't ran in the off season at all. So a lot of times with bursitis, it's a sudden onset where I'm not conditioned well enough and I just jump back into running and I get inflammation in that bursa sac. Because that bursa sac sits in between the tendon and the bone, and so helps for a smooth movement there. And when I just jump back in and not conditioned, that's how that gets inflamed. And then also, it hurts more when I run up hills and on soft surfaces like sand. So, more history about running surfaces, which is something we don't always think about, but it's in the history questions. Surfaces and um, stuff like that. That'll help you kind of get there. I think you got all my other ones. Certain shoes hurt when it pushes on it, so good with that. And then also, this is, and I think Chris will agree with this. When you're looking at anything ankle or feet, it's important to look at the feet and look at the pronation and just the, if there's any kind of pronation or supination of the feet, that can also give you some answers. So with this injury, a lot of times their feet pronate, and it kind of puts like a, do you remember what pronate is? It sort of
Yeah.
tips inwards. Um, that can kind of put like a bend or a twist on the Achilles and can be a reason why some inflammation gets in there too. And then calf tightness too can lead to same thing. So those are two kind of
Wait,
other
calf
things.
tightness can lead to that?
Mm-hmm. Yeah, so that's
Wow.
why I kind of said my calf kind of just feels a little stiff. One way to just,
Oh,
getting that calf loosened up a little bit, because if it's tight, it's really putting pressure on that bursitis.
okay.
Um, and you also actually, I just was researching some extra stuff to tell you with this. You can get tendonitis and bursitis at the same time, and that's called Haglund's syndrome, which we didn't learn that. So there you go. You'll know something that your classmates don't. Yeah, so it's just mostly sudden increase in activity, which the whole haven't ran in the off season would have helped you get there a little bit, but you got there, so you did good.
I have a question. So,
Okay.
like, with tendonitis, how would you know that it's tendonitis? Like,
Well, like I said, you kind of pulled out some key pieces with bursitis, the sponginess, that really
okay,
helped you get there. So just asking more questions and finding things that doesn't really sound like tendonitis, that'll help you get there.
okay,
So yeah, you
okay.
did good.
All right. Thank you.
Yes, of course. Any more questions?
Um, no, I
No?
don't think so.
Good. Okay. If you need anything, if you need any help with anything, you let me know, okay?
Okay.
I'm sure this is hard, so I got you if you need anything, okay?
All right. Thank you so
All
much.
right. You're welcome. Good seeing you.
Good seeing you too.